Your cat can have significant heart disease and absolutely no signs. No heart murmur, no arrhythmia, no symptoms, nothing. We don't have a treatment for the most common heart disease that affects cats, hypertrophic cardiomyopathy or HCM. But all of that is changing, like right now. Hi everyone, I'm Dr. Osk. A new medication called Felycin-CA1 is the first and only FDA-approved once-a-week tablet for the treatment of ventricular hypertrophy. He means thick muscles in the ventricles of the heart. For cats with subclinical HCM. Sorry to bother you, but you said subclinical. So how do you know a cat has HCM when they're not showing any symptoms? And then how do you know when to start treatment in a cat that's not showing any symptoms? Welcome to the wonderfully annoying and confusing world of cat heart disease. In this video, I'm going to chat about HCM, how we diagnose it. Spoiler alert, cats don't play by the same rules as everyone else. Again, cats can have significant heart disease and no symptoms, no murmur, no arrhythmia, nothing. How we manage it and the new medication that hopes to change how we treat our cats with HCM. How common is HCM in cats? It is estimated that 1 in 7 cats are affected by HCM. HCM, or hypertrophic cardiomyopathy, is characterized by muscle wall thickening in the heart, specifically the left ventricle or the muscle wall that separates the right and left ventricle, in the absence of any hormone or issues that affect how the blood flows in the body. The disease is progressive and irreversible. When the heart muscles thicken in these areas, the left ventricle is not performing at its best to pump blood to the rest of the body. The real issue with this disease is the heart ventricle cannot relax. The muscles need to relax so the ventricle can fill with blood, which is pumped to the rest of the body. These changes, if not addressed, can lead to the enlargement of the left atrium. An enlarged or overfilled left atrium can lead to congestive heart failure, where fluid begins to build up on the lungs, and a large atrium can allow a clot to form, which can lead to a thromboembolism, or when a clot blocks a blood vessel preventing blood flow, which can result in sudden death. Which breeds are predisposed to HCM? Even though HCM can occur in any cat, at any age, and with both males and females, genetic mutations and a higher incidence of HCM has been seen with Maine Coons, Ragdolls, Sphinx, Persians, Chartreuse, British Shorthairs, Norwegian Forest Cats, American Shorthairs, and Bengal breeds. HCM is frustrating because for many cats, they have 0 symptoms. And then one day, out of nowhere, they start having symptoms like fast breathing, difficulty breathing, or open mouth breathing due to fluid buildup on the lungs. A clot can leave the heart and travel to another location in the body, blocking blood flow in that area. And the presentation many of you are familiar with is when a clot stops blood flow at the end of the aorta, causing a cat to have difficulty walking or not being able to use their back legs and crying out in pain. Or sudden death. Fortunately, this is rare, and this is why the disease is known as the silent cat killer. Generally speaking, it is only when these 3 symptoms start to pop up that I start thinking about and diagnosing HCM, late in the progression of the disease. And by this time, there is usually significant disease and our options may be limited. If a cat develops congestive heart failure or throws a clot, many of those cats will not live longer than a year, and many cat parents elect euthanasia. And this is just the reality of the disease. If your vet hears an abnormal sound with their stethoscope, a heart murmur, an arrhythmia, a gallop rhythm, anything out of the ordinary, or your cat has a disease that is known to stress the heart, like hyperthyroidism or high blood pressure, that makes it a bit easier to recommend a workup of the heart, and a path forward is more clear. And any of the available heart tests are an option. proBNP blood test, a radiograph of a chest, or jumping straight to an echocardiogram with a cardiologist. I'm sorry, you said proBNP blood test? What is that? There are normally low levels of the prohormone proBNP circulating in the blood. When the heart muscles are stretched or stressed, more prohormone is released into the blood from the affected atrium and ventricle heart muscle cells. And that is exactly what the proBNP blood test is looking for. The more stress or stretching of the heart muscle, the higher the proBNP levels detected in the blood. And this test can be used as a tool to help identify cats with underlying heart disease. This test does not diagnose HCM or any other heart disease when used by itself. Rather, it can be used as a screening test to help identify which cats should have an echocardiogram or heart ultrasound, which is the only way to diagnose HCM and other heart diseases. You should also know that there are two proBNP tests, the SNAP or point of care test and the quantitative test. The SNAP test basically gives a positive or negative result in 10 minutes and should only be used with cats showing symptoms. In fact, a cat that is breathing hard with a positive SNAP proBNP test is consistent with congestive heart failure. The quantitative test gives you a specific number. When that number is 100 or above, we start to worry about underlying disease in the heart. If a cat has respiratory symptoms and the proBNP number is 270 or above, it is very likely that cat has congestive heart failure, which is causing the respiratory symptoms. If that number is between 100 and 270, the respiratory signs may be due to something else and further diagnostic tests are recommended. No matter which proBNP test is used, the more diagnostic tests it is run with, the more useful a proBNP result will be. Once other diseases have been ruled out, like hyperthyroidism, high blood pressure, and kidney disease, since these diseases can all increase proBNP levels in cats, an echocardiogram or heart ultrasound is typically recommended. Now, if you have a negative SNAP test result or a normal quantitative proBNP result, it does not mean your cat has a normal heart. Cats can still have underlying heart disease even with a normal or negative proBNP test. And a negative or normal proBNP test does not mean your cat is normal forever. So retesting, especially if you have an at-risk cat, is recommended in the future with any negative or normal proBNP test. So how are we finding these cats with underlying heart disease that aren't showing any symptoms? Well, it's not easy. The reality is we're not taking chest radiographs in normal cats. Other than doing an echocardiogram or heart ultrasound at-risk cats, the only other screening test we have is the proBNP blood test. And there aren't many triggers to recommend that test. For me, I am typically recommending and running the proBNP test in a cat with respiratory issues, when I hear an abnormal heart sound, or when I take a chest radiograph with suspicious changes. I also offer it to clients for patients undergoing sedation or anesthesia. Some other scenarios to consider may include, if your cat is a breed with a higher incidence of HCM, you can screen with a proBNP blood test. Maybe you add the proBNP blood test to the annual recommended wellness blood and urine screens. Should the proBNP test be run on normal cats without any of the previously mentioned conditions? The answer is up for debate, and there will be many opinions on the topic. For example, running this test on every cat may result in higher incidence of false positive results. In other words, when we screen many cats that are unlikely to have heart disease, the chance of seeing an abnormal result that is not accurate goes up. Some studies point towards a potential benefit in screening normal cats, but the results can be conflicting. One study showed statistically higher plasma proBNP levels in cats with hidden underlying heart disease when compared to normal cats. Some would argue a proBNP result 100 or above may be a good screening tool to help find HCM cats that are not showing any symptoms. The SNAP or point of care proBNP test is not recommended to screen healthy cats. So, should the proBNP test be run on normal, healthy cats to help screen for underlying heart disease? The real answer is more studies need to be done. And again, a negative or normal proBNP test does not mean your cat's heart is normal and healthy. And if this test sounds confusing, you are not alone. This is a relatively new test and we're still trying to figure out the practical everyday use, especially in normal cats. This test does not replace the echocardiogram or heart ultrasound, which is the gold standard for both ruling out heart disease and diagnosing heart disease. Nevertheless, the worst thing that can happen in response to an abnormal or positive proBNP blood test result is you're out a few $100 if that echocardiogram turns out to be normal. At least at that moment in time, you know your cat's heart is normal. And if you find mild underlying heart disease, especially HCM, you now have a treatment option. Felycin-CA1. This medication has been used for years in human organ transplant patients to help minimize organ rejection. And now, this medication is being used to help slow the progression of subclinical hypertrophic cardiomyopathy in cats. Cats with evidence of mild HCM with an echocardiogram or a heart ultrasound that are showing no symptoms. The RAPACAT Study, which was the first study looking at this medication in cats with subclinical HCM, demonstrated that after 180 days of treating cats with a low dose of Felycin-CA1, there was a significant decrease in ventricular wall thickness when compared to placebo cats. And the medication was well tolerated when compared the treated cats with the placebo cats. Therefore, it was concluded that this medication may delay or prevent thickening of the left ventricle wall in cats not showing symptoms of HCM. Instead of just saying we have some mild changes in the heart that are consistent with HCM, let's recheck in 6 to 12 months, we can now offer or recommend a treatment to help slow the progression of HCM in addition to monitoring. And I think the real goal of this medication is to slow the progression of HCM enough so that we either avoid symptoms that are associated with HCM that I chatted about earlier in this video, minimize the symptoms when they do occur, or push back when these symptoms do arise to a later date. As with any medication, there are some words of caution. This medication has a conditional approval by the FDA, which means it is currently deemed safe and has a reasonable expectation of effectiveness. Technically, its approval is temporary and the manufacturer still has to show substantial evidence of effectiveness. One cat was removed from the study because they developed diabetes. The liver enzymes in some cats increased during the study. As a result, this medication should not be used in cats that are diabetic or have had liver disease in the past. If your cat is on this medication, monitor those liver enzymes and watch for changes associated with diabetes. If you are pregnant or breastfeeding, you should not handle this medication. Other side effects include vomiting, diarrhea, lethargy, and a loss of appetite. The most common side effect were symptoms relating to progression of HCM. Even though more studies are needed, this is exciting news for a disease that had no direct treatment, and management was focusing only on minimizing symptoms as the heart disease progressed. We potentially have a proactive treatment before the symptoms of HCM start to pop up. And right now, the HALT study is currently taking place for full FDA approval of Felycin-CA1. If this medication proves to be effective, the only real challenge will be finding those subclinical HCM cats and patient selection. So let me know your thoughts on Felycin-CA1. Drop your comments down below. That's it from Meow. If you enjoyed this video, like, subscribe, and comment. Thank you so much for watching, and I will see you on my next video.